Hey everybody, I hope you're having a great day. I had a conversation recently with a patient where they were feeling better and they're starting to get back to like all their normal stuff, and they're out doing some gardening and shoveling, and then they started to feel their shoulder again, and we kind of got into how they're doing the shoveling, and we found out that they're not moving in the greatest of ways, and it's putting strain on their shoulders. So it reminded me we should probably do, but wanted to do this for a little while, a video where we go over like the better ways to move and then the not so good ways to move when you're doing particular things, so you can avoid all that repetitive strain. This is going to apply mainly to like the shoulders and the hips, but it might also help with your low back as well when we talk about the hips. So just a couple quick concepts I want to go over real quick. Anytime you're doing something with your hands in front of you, especially if you're like kind of doing a pushing motion, like you're putting force forward or like maybe down, like I mentioned, the shoveling, you always, if at all possible, you always want to keep your elbows kind of in closer to your body as you're doing those motions. So I'm going to go through just a few different examples of some different activities here. Hopefully this goes well, and hope you find this helpful. So, ounce of prevention is worth a pound of cure, something like that. So let's say I'm going to go open a door, push open a door. This is how you don't want to do it. With the elbows out, you don't want the elbows flaring out, okay? All right, when I flare my elbows out, it puts a lot of stress on my shoulders. So when I open the door, I don't want to do this. What you want to do is keep your elbows in close, like I mentioned, and kind of do this to open the door. All right. Or if I'm with one arm, again, avoid this. Don't do this. Do it more like this. Keep the elbow in tight. Okay. So we're going to go over some other examples here. Hopefully this I can put this. Okay. Let's say I'm doing some overhead work like painting, or I'm fixing something overhead, or I'm doing something overhead where I have to have my arms up for a period of time. I'm in the clinic. I don't have a paintbrush right now. I'm going to pretend our hammer here is a paintbrush. So this is what you would not want to do. You don't want to again, don't flare the elbow out while you paint. Okay, or whatever you're doing, you want to keep the elbow in kind of closer to your body and move in this fashion. You can even use your legs and your body to help you move this way versus being, again, like this. So this is not good. This would be better. Okay, let's say I'm going to place something up on a higher shelf. All right, next to St. Francis here. This will be not the way you want to do it. Don't flare the elbow out. Maybe you can see it better this way. No. Don't flare it out like this to put it up or to pick it up. This would not be good. Take it like this, or maybe I would do this. Put it up that way. Keep the elbow close in towards your body versus, again, out here. Let's say I was going to pick this up. This would be a better way to do it. Kind of get close. My elbows are in tight. Okay. Same thing if I go to put it back up. Versus I don't want to be out here and then. Okay, this is not preferred. Next, we're going to go over just a few quick things about the hips and knees. So a little bit different from the shoulder, where we want to keep the elbow in close when we're doing anything in front of us. As it pertains to hip and knee, with the knees, we don't ever really want the knees to kind of go inward or collapse in when we're doing most things. We want to keep tension outward on the knees, and hopefully you can see what I'm talking about here on some of the examples. So first I'm going to do some walking here. I'm going to walk down and back twice. The first time I go down and back would be what we don't want to see, where like the feet kind of toe out and flare out, and sometimes the knees collapse in. And then the second way I walk is, how we prefer people try to walk, or more upright, knees even, or tension on the knees out a little bit, feet straight ahead. All right, so this is first not the best way. Now, that might be like a little bit of an exaggeration, but you don't want your toes flared out like that. This may look somewhat familiar to some of us. The preferred way to walk is you can see the feet are straight ahead, not really pointed out at all, and knees are straight and in line. Okay. Next, we're going to go over a couple other things like getting up and down, squatting, and the stairs probably. Okay, so this would be getting in and out of a chair. We work with folks a lot on this, on how to do this better. Okay, here's some things we don't want to see. Okay, we don't want to see toes out, and oftentimes this will happen. Knees come in. All right. Okay, you want to avoid this movement pattern if at all possible. Okay, ideally, plant those feet straight ahead. Keep tension on the knees outward. All right, and maintain that tension as you stand up and sit down. So you can see the knees kind of stay in line with my feet, or even a little bit outward. All right. All right. Even if you have to use your hands sometimes to help you get up, you can still practice that movement pattern with your legs. Okay, this is much better. I'd rather see someone do this as they're able, rather than, if not using their hands and kind of doing this kind of thing. All right. Same or similar concept goes for steps. Okay, if you're going up steps, ideally have the foot straight, tension on the outward, and you would step up and down like so. Okay. Same thing stepping down if you're going down the step. Okay. That's preferred. Okay. Much less stress on the hip and knee. And it helps a lot of our folks with that have low back pain too. Here's some examples of movement kind of faults we see, or errors. You can see again, it's usually the foot's toed out, which makes the knee it makes it much easier for that knee to kind of cave in. Same thing coming downstairs, doing that. Okay, this is not a great position for the knee or the hip. Okay. All right. So again, here's just to review real quick, a good one. Hey, I hope you all found these helpful. I can't tell you how many people tell us they just feel better from just being aware of these things. Sometimes just being aware of these things and practicing and trying to change how we move goes a long way. All right, have a great day, guys.